Hello everyone, this is Dr. Sushma Sarilla, consultant homeopath at Fidicus Homeopathy. Now let's go into the investigations part of bulky uterus. The primary investigation or the primary thing that any person who is suffering from bulky uterus should do is get clinical evaluation. So what is clinical evaluation? When you visit a doctor, they will be asking you first about your symptoms. What are the symptoms that you're presenting with? And not only that, they will do a bimanual examination, bimanual pelvic examination if needed, and they will suggest you for the investigations. So what are the primary form of investigations are the imaging techniques, that is ultrasonography. This is the primary and the most thing that the doctor advises if you feel or if they feel that you are suffering from bulky uterus. So in the USG, you will be finding bulky uterus. But if they need a little bit of more information regarding that, then they might suggest you with an MRI. So that will give you more crucial information that is not present in your USG. And also hormonal and blood test. Remember that when you visit a doctor or when you're coming to us, we will analyze your case, and regarding the symptoms, relating to the symptoms, we will tell you about the investigations. Not all kinds of bulky uterus symptoms need certain investigations. For example, if you're suffering from hormonal imbalance, you will be presenting with either irregular menstruation or prolonged menstruation, or you're having fertility issues. Then we will ask you to get your hormonal and your blood test done. If you're having prolonged bleeding, then we will ask you to get your CBC done, which is complete blood count, where we will be able to see your HB count. And not only that, we will be able to analyze if there is iron deficiency. And not only that, and then after the complete blood count, you will be asked to do your thyroid profile. Why thyroid profile? If there is irregular menstruation, if there is one menstruation or one bleeding where it is very low and the other one is prolonged, there is irregularity in the menstruation, then we will ask you for your thyroid profile. And if you are having fertility issues and if we feel that it is always associated with PCOS, then hormonal profile. We will ask you about your hormonal profile. In the hormonal profile, if there is any fertility issue, then your prolactin needs to get done, and then estrogen and progesterone for the endometrial thickness, and also FSH and LH for your ovarian function. Next, coming to endometrial evaluation. If there is postmenopausal bleeding, that means there is something fishy. So if there is postmenopausal bleeding, then we will ask you for endometrial analysis, that is endometrial biopsy. Remember, postmenopausal bleeding, endometrial analysis or endometrial biopsy. And then coming to hysteroscopy. If there is something, if there are uterine abnormalities found in the MRI, then we will go for hysteroscopy. Additional tests. If there is bleeding on touch, that is, if there is bleeding even while examination, on touching the finger to the cervix, this is the cervix, and during bimanual examination, just the touch of the finger or touch of an instrument is causing severe bleeding, then that is just for cervical cancer. So we can get a pap smear done. So these are the additional tests that need to be done in bulky uterus. Coming to the consultation part here at Fidicus. If you are suffering from bulky uterus or if you are suffering from any female reproductive problems and you want a proper cure, here at Fidicus we are offering you with two different types of consultations. The first one is online consultation. If you are not near our nearest branches, you can consult us online through two options. One is the audio consultation, second is the video consultation. And you can share whatever investigations that you have with us, and if we need anything more, we will suggest you. After doctor consultation, you need not worry about the medication. Your medication will be delivered to your home within 3 to 5 days if you are staying in India, 3 to 6 days if you are staying in USA, and 4 to 8 days if you are staying anywhere else. If you are staying near the nearest branch of Fidicus, then you can come and consult us in person. If you are suffering from any of the female reproductive organ diseases and you would like to get in touch with us, you can consult us through this number. You can call us, WhatsApp us, or message us through this number. If you're suffering from bulky uterus or any of the female reproductive organ issues and you're looking for a proper cure, why should you choose Fidicus Homeopathy? Here at Fidicus, it stands for highest chance of health, and we are having 3 principles that we follow. Remember that we have already had bulky uterus cases with high success rate, and also the treatment we give here is proper, and there is no gray area between the patient and the doctor. It is always black and white. That is we stick to the rules, and also we will explain it to you if you have any sort of doubts. The personal care that we give here, if you're having any sort of doubts, you can discuss it with us, and we are here to help you. The personal care at Fidicus is top notch. If you want to choose homeopathy, if you're looking for a proper treatment, and if you're looking for cure, choose Fidicus Homeopathy. Thank you.